According to the Philippine Statistics Authority, the overall health expenditure in the country increased by 8% from 2016 to 2017, where a majority of the expenditures are from household out-of-pocket payments. While the individual poverty incidence stands at 21% as of the first quarter of 2018. With a growing number of Filipinos burdened by health concerns, in conjunction with the number of Filipinos who are restricted by poverty, healthcare insurance would surely help aid medical expenses. That is why we are here to discuss the universal healthcare law in the Philippines.
Sustainable Development Goal number 3, or otherwise known as Good Health and Well-Being, simply aims on ensuring healthy lives and promoting well-being for all in all ages. Three of its many targets include ending the epidemics of AIDS, malaria, tuberculosis, and other tropical diseases, achieving universal health coverage, and increasing the capacity of countries, especially developing countries, on global and national health risk.
SDG number 10, or Reduce Inequality. This SDG aims to promote equal opportunities for all, not only in income inequalities, but also through the following factors like age, race, sex, socioeconomic status, and religion. This SDG promotes that the government should make efforts like policy reforms in order to address the people who are experiencing inequalities.
We are here today in Quirino Memorial Medical Center to interview Dr. Hanairo, the Regional Director of Calabarzon.
Dr. Eduardo C. Hanairo, Regional Director of Calabarzon. I've been in government for 38 years, and this is my 9th region being served. So the Universal Healthcare Law is actually a law mainstreaming the good things we are actually doing in the health system and giving us the opportunity to make equality, the right condition, the right needs of the people, the right financing, and the right management of healthcare can be. Walang maiiwang Pilipino should enjoy the benefits from what we are trying to do now. So there's nothing new in it. We just want to mainstream it and make it more stable and more determined by itself. It might take 3 to 10 years bago mo mag-enjoy because we have to restructure the whole system. Not only to restructure the whole system, but we have to put things in their proper places. For example, we have to access all people to a primary care level. So, the first navigator. Ang basic behavior na mararamdaman ng tao, dapat, in the long run, after 10 years, hindi ako dapat matako sa health system. Kasi mayroong gagastos para sa akin o may naggumastos na para sa akin at makukuha ko ang service ng mas competent na tao. At aalagaan ako hanggang sa bumalik ako sa bahay ko. Yun yung basic frame. Na kailangan lahat ng ahensya ng gobyerno kasama attached agency nakapasok dun. Now, the management has to change. Even the PhilHealth concept has to change. Now, although to date, hindi pa naiisip ng mga taga-PhilHealth yan kasi hanggang ngayon naka-frame sila on the profit orientation ng insurance system. Actually, during the development of the law, we want to change the name of PhilHealth into a security agency or a protectorate agency. Kasi when you use the word insurance, pumapasok yung tinatawag na profit orientation, yung reserve na tinatawag. But this is a social insurance. And when you talk about social insurance, you're given only 30% unreserved. Because the idea is, hindi naman nagbabayad voluntarily yung mga tao dyan because it is automatic that those people in government will need to sell a part of their salary for PhilHealth as a premium payment. Diba? Automatic yun, every year yun. So, paano ka malulugi? Not only that, the national government is putting in funds for PhilHealth. DSWD, PAGCOR, PCSO, they are putting funds, although separately, but they are putting funds in PhilHealth. So, there's no problem in that case. Dahil every year pala, may pondo ka. So, there's no such thing as nalulugi. But if you think you're a private insurance, malulugi ka nga. Nagawa ng implementing rules and regulations, marami nang sinasubject na sa public hearing, and then hopefully yung implementation level maumpisa next year. Sa other universal healthcare, existing ang local health board, magkakaroon siya ng sariling procurement, magkakaroon siya ng sariling administrative financing function, and then yung kikitain ng network, ng Universal Healthcare Network ng province, pupunta yan sa tinatawag nating general fund ng province. Pero automatically, yung amount na kinita na yun, hindi siya pa pwedeng ilagay kahit saan except the system ng health. So automatic earmarking of that income coming from the health system. And then, the local health board will have to function as if sila na magdedetermine how much ibabayad sa bawat RHU na magiging member ng network. So meaning to say, may special health fund na tinatawag ang local health board, which is separate from the local or provincial health fund. It is earmarked for the local health board. Actually, the strength of the law is in the law itself. No, there's so much in it, but however, ang weak niyan, interpretation of people who will make the IRR. Yun yung weakness. Kasi ano nangyari, when the law was passed, lumabnaw siya. It is now subjected into so many interpretation concept. Now, ang IRR, kung copy-paste lang yan, mas malabo mangyayari. Pero ngayon, ang nangyayari nga, meron kang IRR who's making some specific definition of what was given in the law that makes it more restrictive. Ang priority nga ng Universal Healthcare, yung mga malalayong lugar. There are ways to do things to access health. Meron kang telemedicine. When you say telemedicine, pwede ka gumamit ng Skype or yung face-to-face. Cellphone for audio. And there is a gadget na pwedeng tumingin ng stomach mo, proctoscope, pwedeng makita eye, ear, nose, and throat mo, na kahit nandito ka sa Maynila, ang pasyente po nasa malayong lugar, kaya yun. Actually, pwedeng maramdaman agad. Hindi kasi kailangan mabago mo yung buong sistema, right there and then. Hindi kailangan magpatayo ka lagi na lahat ng ospital o i-upgrade lahat. We can work the system with what we have at present. Only if you know how to fragment things. We know so many graft and corrupt practices inside PhilHealth na kailangan, kaya sabi ko sa inyo, kailangan na nating tanggalin yung mga tao doon. Una-una, mali ang pananaw nila. At the same time, they have been making a lot of policies that increase their wealth, not increase the health of the people. Kaya kung hindi mo babaguhin ng PhilHealth, walang
To sum it all up, the Universal Healthcare Law is a huge step towards health development in the Philippines, providing medical financial aid to every Filipino and promoting preventive health measures. One of the ways in which SDG 3, good health and well-being, as well as SDG 10, reduce inequalities, can be achieved is through telemedication, which Dr. Hanairo explained to be a more efficient way of communication between a patient who is in a far-flung area and a medical practitioner that is made possible through technology.
So in addition, able to provide equal accessibility of medications for all, changes in the management system of PhilHealth is essential. In conclusion, the future of an equitable society in terms of medication is and can be upon the Filipinos if the government is willing to continue working upon it.